Hello, good evening. So first the disclaimer that all the images which will be displayed during this medical training session, they are for educational purpose only. All right. Yeah, a few questions. When will we start head and neck? After completion of this abdomen. And I have already created the link for today. It is already there and tomorrow will be the grand finale. That is the final session for abdomen. And in that we'll be including some of the topics straight away from even obstetrics. So actually how the entire process of delivery it occurs. So that is where we'll be implementing everything whatsoever we learned in the abdo-pelvis, right? So that would be where we'll be taking it into quite a detail so that even all the stages they will be discussed. All right, so today is the day of all those plexus, right? We were discussing about the dorsal rami and ventral rami, and then those inferior hypogastric plexus, superior hypogastric plexus, and then we were telling sympathetic fibers, they come from here, there, everything. Yeah, I'm good. Audio is not, is the sound okay? Can you hear me properly? It is not audible. Well, over here it is showing it. My meter is showing correctly. So just let me know. Do I need to raise the voice still more? Okay. Is it audible? Please just let me know. Okay. All right. Great. Right. So today we'll be talking about all those plexuses. We'll try to simplify it as much as possible. Okay. Okay. Right. So we'll be starting with right from the spinal cord and then we'll go for all the way up to the formation of all those plexuses. In fact, you'll find that it is like a circuit, right? And it would be very interesting to see that how it actually forms. So let's start with the simplest of all, right? That what we shall be talking about. Let's finish the arteries and the veins first, right? Because there are so many things even in that also, so many things to learn. So let's start with first, and that is our internal iliac artery, right? Internal iliac artery. So there was that common iliac artery. From common iliac, there was external iliac artery, and then the internal iliac. It is the internal iliac which is vital for the perineum, correct? So it is this internal iliac which is supplying perineum. All those topics, right? What we discussed. Then the gluteal region. We'll see all the branches, right? Then the iliac fossa, that was part of it. And finally, all those pelvic organs, right? All those pelvic organs. So this is where we'll find that everything was fine except one thing, right? Pelvic organs, except if we really want to write one artery, name of the one artery, and that was like say superior rectal, right? Ovarian, median sacral, because those are like say and the median sacral. Median sacral was, if you remember, that was a lone artery, right? It was not a paired one, it was emerging directly from the aorta, right? So all of them, they are direct. One important point that in fetus, it was the internal iliac artery, which is bigger than external iliac artery, right? Because it was the internal iliac artery which was actually transmitting the blood to the placenta, because there was umbilical artery, right? So in internal iliac, there was that umbilical artery, and that umbilical artery which was like a connectivity to the placenta, right? So all the blood was actually getting transmitted via that, but then it gets obliterated, right? And so that external iliac takes over. So that's how the entire layout is. So our prime focus would be on internal iliac, right? Let's dive deep into this internal iliac. If you see how its arrangement, right? How it's arranged. Its arrangement, so anterior, posterior, right? First thing that. Just anterior to it, the structure which is anterior, right? Over there, it would be ureter, right? And the posteriorly, this is internal iliac vein, right? Then all these topics, right? Then lumbosacral trunk. Now this lumbosacral trunk, this would be very important point. Now today it is not like that there is only one guest of honor, right? There will be so many guests. There'll be like a panel. So this lumbosacral trunk will be one of the candidate from that panel, right? So many important topics, but yes, this would be a super topic, lumbosacral trunk. And obviously posteriorly, right? So there is sacroiliac joint, right? Sacroiliac joint. Because sacroiliac joint has been talked about, so it is just the bony structure, right? So it is on the pusti aspect. So that's anterior, posterior. Regarding the lateral and the medial part, right? Medially, if you see, medially, because this is the artery which will be coming from both the sides, right? So over here on the medial side, there would be peritoneum and plus all those tributaries of internal iliac vein, right? They will be like on the medial aspect. And on the lateral aspect, the lateral aspect is interesting. Now this will help you to generate a picture. On lateral aspect, we have external iliac vessels plus obturator now. Now see how we plan. The whole idea is that over here, this is our internal iliac artery. On the lateral side, there is external. That's why it is external, right? Because lateral, it is, so lateral side is external side. So that's why we gave it the name that external. So this is easy. External iliac vessels, that is external iliac artery and vein, they both are associated with obturator now, right? And this is what we'll be watching, that there is a very definite relation nerve, artery, vein. That's how they are arranged. So we'll see that arrangement, right now we are not disturbing it, right? We'll see to it as it will come. So we just say NAV, nerve, artery, vein. Okay, so that lateral part is easy, right? Because of this easiest concept, it is external, so it is lateral. Yes, I am good, right? So external, so it is lateral. Medially, yes, peritoneum and all those tributaries of internal iliac vein. Tributaries of internal iliac vein, why they are important? Because all those tributaries, when normally we don't give much importance to veins, right? We just say that veins, they are like, no, they are like arteries, right? Similar name. But over here, there'll be so many different things because internal iliac vein. And then there is a complete system, right? This is the cable system, but then there is a portal system also, right? So that is where, if you remember, superior rectal vein was draining into inferior mesenteric vein. That inferior mesenteric vein which was going into splenic, and then they were joining all the way to portal, and then into the liver, from liver hepatic vein, and they were landing into the vena cava, right? So that's, we will see that, but that is where things would be a bit different. So right now we just remove this, right? In any case, it is going to come in great detail as we proceed. Okay, so far easy. Anterior, yes, it is ureter, and posterior, we have got this lumbosacral trunk. Lumbosacral trunk, it is associated with sacroiliac joint, right? It is landing exactly on that bed only. It is lying lumbosacral trunk. So all those nerves, they are in the background. They are in posteriorly because they are emerging from the spinal cord, right? So that's why they are on the back side. Done. Now starts the systematic explanation. Everything we have to see it in such a, we'll be discussing each and every artery, right? So that it is crystal clear that how are we going to see the picture. So branches of this are internal iliac artery. So internal iliac dividing into anterior division, posterior division, right? So that makes sense. And one which is going anteriorly is anterior, the second one posterior. This is parietal and ventral. That is in case of posterior, because there is nothing like ventral. So we just say the posterior division, it has got 3 arteries, because in ventral there is nothing. So as such, this is 1, 2, and 3. These are the branches of posterior division. However, for anterior division, things are a bit more interesting. For anterior division, it is the parietal branch and the visceral branch. Name itself is telling visceral branch. That means they will be going for specific viscera, right? That is for the specific organs. So here it is going for urinary bladder, this is for rectum, this is for bladder, this is internal pudendal. Oh, internal pudendal to is, yes, you can say it like chief guest, right? Because again, it will be giving supply to, it will giving blood supply to so many organs. Vaginal, it is in case of female, because in inferior vesicle, in fact, inferior vesicle, in case of female, it is the vaginal artery. And then uterine, that is obviously only in case of females, right? So it means all these visceral, they are associated with the viscera. That means that this parietal is in general which is supplying all those muscles, etc., right? Inferior gluteal, so you know that inferior gluteal, and here it is superior gluteal. Remember it like this: superior gluteal and inferior gluteal. Superior gluteal is branch of posterior division, anterior is branch of inferior gluteal. Inferior gluteal is branch of anterior division, right? We'll see that. We'll see actually the images so that it becomes clear. Do remember obturator is important, but in case of obturator, we just said that obturator sheath, obturator foramen, all those things will come into picture. Lateral sacral, name itself says sacral region. Iliolumbar, yes, ilial lumbar, again, they are posterior. They have to be posterior, right? These two. Okay. Now, let's see them over here, right? Again, like our standard practice, instead of watching this whole picture like this, we'll start giving the numbers so that there is a proper formation that how should we really look at this image. So these are all, as we said, branches of internal iliac artery, right? Let's start. Common iliac artery, this is 1, right? So we know this now. This is fine. Common iliac divides into external and internal iliac. So here is this is big one which is going, right? So this is adult. So it is bigger. So that's number 2, external iliac. Then what it is dividing. This one is internal iliac. So now internal iliac. Our today's focus is purely on internal iliac. So external iliac now we are not talking about, right? So from here, now internal iliac. We said that internal iliac will be divided into anterior and posterior division. Yes, very nicely written. So 1, 3. So we give this as number 4. So here is the anterior division and the posterior division. So yes, that makes sense, right? That's the anterior, which is going anteriorly. Let's change the color. This is anteriorly and this one is posteriorly, right? So they both are now clear. All those branches which we were talking about, right? They will now start appearing over here. So first what we do is, let's finish off the easiest portion first, right? Which was the easy one? That posterior division, right? Just for the recollecting. This posterior one, right? This is easier because just 1, 2 and 3, those three: iliolumbar, lateral sacral and superior gluteal, right? So here it is. So we have talked about this part. This is posterior division, right? In posterior division we said iliolumbar, right? So that's iliolumbar number 5, right? So that is iliolumbar. Yes, it is going up. So and on the back side, yes, that is iliolumbar. Second one was lateral sacral. Here it is, right? That one is lateral sacral. So that is lateral sacral. And then there is big one which is going into the gluteal region, and that is superior gluteal. So it means this. Done. Right? So all of them, this, and this. Just for our understanding, right? We are writing it over here that they were parietal branch. They were parietal branch, right? As such branch, right? Because there was nothing like another one. So parietal branch of posterior division, right? So this is posterior division, internal iliac artery. Okay, posterior part is complete. Now comes the anterior. That is what is to be clearly understood. So back to black color, right? So we were at number 7. Now see, again we finish off the parietal branches first. So which were the parietal branches? One was, see, this inferior gluteal. Now because they are important, so we are just marking them separately, right? Let's do it like this. Say iliolumbar, lateral sacral and superior gluteal, right? They are marked with, they are highlighted with yellow. Now all of them which are of anterior division will mark them with different color. So first thing first, this is inferior gluteal, right? And we mark it as number 8. What was that inferior gluteal? Parietal branch, but anterior division, right? So it is like, say, we know that this is anterior, right? Over here, anterior division, this is anterior, and this is the parietal branch. So parietal branch. So that was first, inferior gluteal. The next one we said very important, obturator, right? So here it is, obturator, right? So we mark this as number 9. So this is obturator, right? They were like parietal branch, right? So we are talking about this and this, right? And we have already talked about this one, lateral sacral and superior gluteal. So once they are done, rest is now very easy. Now see, these were the parietal branch, right? So that is also a parietal branch. Now all of them, they are visceral. Now when they are visceral, so they automatically become pretty easy. So 9. The visceral branch, we start with this superior vesicle, right? So this one, superior vesicle. So we just mark it like this. So all of them, they will be our visceral branch. Deep circumflex inferior epigastric, we are not touching, right? We are not touching because they are not part of internal, they are part of external. So then why to confuse? So we just strike them off. We will not touch them right now. Superior vesicle, if this is superior vesicle, then which one would be next, right? There was medial rectal, right? Superior vesicle, and yes, we can finish off this inferior vesicle also. So superior vesicle here and inferior vesicle here. But at this point, we would like to add a note over here because this inferior vesicle, in case of female, that would be vaginal artery. So that is done. And when we are writing it over here, so then why not to write a big plus that in females only there would be one more extra artery, and that would be the uterine artery, right? So that part is done. So that was inferior vesicle. Straight away we move on to the middle rectal, right? So as we mark here, middle rectal, we mark here, and then the last and final, most important, right? And that is internal pudendal. So this is, now this picture would be much more easier. So whenever you revise it like this, right? Anterior division, posterior division. In the posterior division, let's finish it first, right? So that's how you finish off all those three, right? And then go to anterior division. In anterior division, first the parietal part, those which are obturator and inferior gluteal, and then rest are all visceral, right? Now let's see all of them actually, right? How they look like. Okay. So here this is aorta, then this is common iliac artery, this one is external, and our internal iliac is this, right? So that was easy. Let's move further. This one is external iliac artery, this one is common iliac artery, and that's our internal iliac artery. But why we are zooming it? It is when we really want to see that how it is getting divided. So this is the anterior division, and that's the posterior one, right? Anterior division and the posterior division, right? Anterior division and the posterior division. Okay. Now we'll focus only on those branches, right? This is how the whole thing would really look like. But we know that in case of males, there are 6 branches, and in case of female, there are 7 branches because that uterine is extra, right? But these are for anterior division, correct? These are for anterior division. Yeah, obviously these are the visceral, right? All visceral. So this is how actually when we see it looks like this, right? In real body, the things would be still more complicated. So how to decipher, right? In case if someone lifts that, which artery is this? How to figure it out that which artery is what? So let's see it in a different perspective. See, same image, right? But just one is highlighted, and this is what, this is umbilical artery, right? Because when we trace this thing, so this one, right, all highlighted, right? There I have highlighted only one artery per image to make things easier. So it is this umbilical artery, right? And umbilical artery, as we said, that this artery after birth, right, it say only its part persists, rest is degenerated, and the degenerated part is what we call as the medial umbilical ligament. Correct? So that's how this really goes. Only important point is only proximal persists. Proximal part persists. Right? Only proximal part persists. Now see, that's how it goes. Right? See, this is umbilical artery. And see this degenerated portion, that would be the medial, right? Medial umbilical ligament. This one, right? That is the medial umbilical ligament. This proximal part which persists, right? This proximal part which persists, that would be leading to superior vesical artery. Right? So that would be leading to superior vesical artery. Here it is. Right? We'll see it in next. This one. This one. Yeah. See, that's superior vesical artery. This is superior vesical artery. Now, this superior vesical artery, this is giving a visceral branch to nearby structure. Name itself is telling vesical, so one has to be urinary bladder. Correct? Urinary bladder. So, for today's session, right, let me finish, then just I want to tell one thing. So, urinary bladder, and in case of males, artery to ductus deferens or the vas deferens. So, it is artery to vas deferens. Now, should I write it properly? Deferens. Three things to be said. One, there was one email that abdomen series lectures, they are very long. Agreed, because topic is like that, right? But I said that you just see the session once, and then you don't have to see the videos again and again. In case if it is needed, you can always watch, but important is while watching the video, just follow this PDF, and then when you go for the revision, just see those PDF, right? You'll be able to finish the things much faster. Question was, is there any shortcut? No, gentlemen, there cannot be any shortcut, right? And don't even attempt for the shortcut. Even in my comments also, I wrote that see, this medical is like a marathon. It is not like a sprint. Head and neck, again, it would be a long session, right? There'll be many long sessions. This was one. Second, say for example, today's session, as we are watching that, okay, this is like common iliac to external and internal iliac, from internal iliac, these are the divisions, and that's how it is coming. So when you revise, right, from this PDF, you keep on going back and forth, so that you remain into the reference. Yes, what exactly are we talking about, or are we discussing? This would be very important when we'll be talking about those nerve plexuses, right? So here it is, it was easy, right? That umbilical artery, right? Only the proximal part persists, and that goes to the superior vesical artery, and that superior vesical artery supplies nearby organs. Nearest name itself is telling urinary bladder and the artery to vas deferens, right? Okay. We are now talking about this artery. Now where exactly it is, right? Where exactly it is? This is what is obturator artery, right? That's the obturator artery. Yes, it is parietal, right? It is a parietal branch. And in obturator artery, you remember we said that nerve, artery, vein. That's how they are arranged. So nerve is on the top. After that, there is artery, and vein is below. This is the arrangement for obturator, right? And with this arrangement, they pierce that obturator sheath, and that's the obturator foramen, and then it enters into thigh. So that is how it really goes. Our interest, this artery, obturator artery, it supplies some important structures, right? It gives all those iliac branches because that's the main artery over there. The nearest structure, it gives vesical branches, right? And it forms anastomosis. That is anastomosis with all those pubic branches. So that's what it really does. Let's move on to the next one. Yeah. Now see, that one was obturator, right? But all the way, this is going on, and it is continuing as over here. And it is going posteriorly, right? So this is inferior gluteal. Inferior gluteal artery. So this one, this one was obturator, and this last one is inferior gluteal, right? And all those in between, they are all viscerals, right? Inferior gluteal artery, this is the largest, right? This is the largest. And yes, that no wonder, this is about anterior, right? Sorry, this is anterior, that one is posterior, right? So largest branch of anterior division. And then this will be going into the buttocks and the posterior thigh, right? It will go into the posterior thigh plus hips, right? Name itself is telling gluteal. So that's why, right? It will be going over there. And it is going via that greater sciatic foramen. Now, during this journey, it would supply, right? Here we are dealing with only inferior gluteal artery, right? Inferior gluteal artery. So this inferior gluteal will be giving some muscular branches, but at the same time, it will give some vesical branches to bladder, seminal vesicle, prostate, all those things, right? Bladder base. Do you remember we are talking about bladder base, right? And those posterior structures. So what was that on the posterior side, right? There was seminal vesicle, right? There was seminal vesicle, right? They were on the posterior side. Then just underneath there was prostate, right? All of them, they were entering into the prostate. So it supplies branches to them, right? Always remember nearest supplies. Now starts the viscerals, right? Now they are pretty easy. See the first one. The direction itself, it is inferior vesicle, artery, right? So that one. And yes, this is in case of males, because in case of females, it would be the vaginal artery. In case of females. Now this is important, right? Because this is supplying what? It would be supplying the trigone right? That was the trigone in the urinary bladder. That was the trigone. So this part is supplied, right? Then in the neck, there was prostate. So it will be supplying the prostate, right? Obviously, on the back side, there are seminal vesicle and the plus the ureter, lower part. So pretty important. Pretty important. Ureter, seminal vesicle, prostate, and the trigone, right? So just I'm writing trigone, seminal vesicle, because there was one suggestion to write everything, because he said that sometimes when we watch the video we do remember, but then what was SV, it becomes difficult. No problems, right? It happens. So this is like, unless you tell me, I won't be knowing it. Prostate and the lower part, right? This way we can write lower part are ureters, right? So that's how, say, they are supplying. Yeah, in case of female, things would change a bit, right? It would be the name itself, so it would be supplying vagina plus the vestibule. Vestibule. Right? Obviously, the base of urinary bladder, right? That is obvious. Urinary bladder base. Okay. Now that this is middle rectal, right? That one is middle rectal. Again, the visceral branch of anterior division, correct? This might be absent. Some of its features, important features are: one, it might be absent, right? Might be absent. For the namesake only, it is rectal artery, right? Otherwise, it supplies very less blood to middle rectal, because maximum blood is supplied by that superior rectal, right? So here it supplies very less blood to rectum. So just for the theory purpose, it is those muscular coats, right? Those muscular coats, they are supplied. So then whom is supplying? It is supplying prostate and seminal vesicle. So that's what you should be remembering, that for the middle rectal artery, when the question is asked, it is very easy to say that yes, name is rectal, so everyone would say that it supplies rectum. No, right? This is where you will never miss this point, right? So we put a star. So during revision, always go for those stars. That means something is there to remember. Okay. So obturator, right? Then inferior vesicle, then there was middle rectal, and this one is big boss. This is internal pudendal, artery, right? And internal pudendal, it supplies so many, right? So many. Its branches, if you go, so then it is like that inferior rectal, right? Then all the perineal branches, right? Perineal branch, then it supplies to urethra, correct? All those rules. Then very important, deep and dorsal artery of penis. That's why this artery is very vital, right? Because this supplies perineum plus external genitals, right? So we are talking about this internal pudendal. Right? And the keywords which you will carry is these two. That one, it supplies perineum, and second is external genital. Right? Okay. So this is posterior division, right? So that one is anterior, but over here highlighted part. So this is posterior division of internal iliac artery. That one is posterior division. Now in posterior division, there were three arteries. Iliolumbar, which was going up. So here it is, right? This one, this one. This is iliolumbar. Then second, which was lateral sacral, right? And that is this one. That is lateral sacral. And the third one was superior gluteal. It is here, right? So superior gluteal artery, and it is this, right? So 1, 2, and 3. And all of these are like the only posterior division, internal iliac. So whether we say them parietal branch, then I think it is fine, right? Because there was no visceral. So now internal iliac is I think clear, right? We just talk in brief about all those three major vessels, right? Those iliolumbar. Only the keywords will be sufficient. So iliolumbar artery, say it divides it into two parts. It has got one lumbar component. It goes the lumbar, and then there is one ilial component, right? Ilial. So when it is lumbar, this actually represents L5. That is the fifth lumbar artery. It represents fifth lumbar artery, right? So that's why it is important, because one of the branch, which is the spinal branch, and this would be supplying the tail of the spinal cord, and that tail is cauda equina. Cauda equina, right? So see, iliolumbar artery, which is like the parietal branch of the posterior division, right? Internal iliac, and then from there the common, then the above was aorta. So all the way divide, and it goes for this L5. So this lumbar component will be supplying all those muscles which are just into the base, right? So one was our all-time favorite, psoas major, right? Then that very disciplined quadratus lumborum, right? Very good geometrical muscle, lumborum. And name itself, erector spinae, keeps the spine straight, right? So all these posterior muscles, they are by this lumbar one. Ilial, it has to be something which is related to iliac fossa. So iliacus plus everything in iliac fossa. So that part is taken care of by ilial. So all those anastomosis, etc., whatsoever is formed, all it is the responsibility of this iliolumbar artery, right? So that is the anastomosis near anterior, superior iliac spine, right? Anterior, superior iliac spine. So this iliolumbar, this is just in front of that sacroiliac joint because going posteriorly, right? The next artery, which was over here, that was the lateral sacral, correct? Lateral sacral. Now lateral sacral artery, divided into two parts. There is one upper and another one is lateral. Name is telling lateral sacral. So all the way, everything associated with sacrum. So those muscles associated with sacrum and the sacral joints, right? That is lateral sacral. Everything on the back of the skin of the sacrum, etc. Right? That is by lateral sacral. Yeah, we'll start. The third one is superior gluteal. Now this superior gluteal, right, from pelvis, it will be going into the gluteal region, right? And when we saw that artery, we said that it would be crossing this thing via greater sciatic foramen, correct? The lower part, greater sciatic foramen, right? And then via that into the gluteal region, it supplies gluteus maximus. Gluteus maximus, right? Then everything, all the bones which are associated, bone, skin, muscles, everything, right? So obviously over here there would be trochanter. So trochanteric anastomosis plus the skin around it, muscles, right? So they are supplied by this superior gluteal. Now once we have seen these artery, watch for that how easy it becomes for internal iliac vein. For internal iliac vein, the time spent for artery, right, not even 1/5 time would be spent for internal iliac vein. It would be that fast. How it is formed? Well, external iliac vein and internal iliac, they both would join to form common iliac vein, and that common iliac vein would finally will meet on both the sides and will be going in the form of inferior vena cava, right? This much we know it. Inferior vena cava. Now these are the veins. So veins means there will be tributaries. So all those they will collect together and then they will lead to formation of internal iliac. So that's why we are drawing the arrows ulta, right? This way, because everything is going over there, like this, like this, like this, right? These are veins. Why stressing so much on that? Because still tributaries, this is okay, right? Tributaries, that means they will be joining and forming the internal iliac vein. So over here, the way it was like artery, same way over here, it is the superior gluteal vein, right? Superior gluteal vein, which is largest. Then there is inferior gluteal vein, right? There is inferior gluteal vein. Then same way there was internal pudendal. So here also there is internal pudendal vein. Obturator was there. Here also, this is obturator vein. Lateral sacral. So here also there is lateral sacral. So practically all of them. And just remember the superior gluteal was the largest and they lead to formation of internal iliac vein. But the story is not ending here. Here comes the plexus. Because for arterial supply, when we were discussing rectum, prostate, uterus, right, we were telling that, okay, these are the arteries which are supplying, like directly they were landing and they were supplying either the muscular coat or the entire organ, etc. But when it started in the form of reverse journey, suddenly those veins, they were accumulating together, they were forming all those plexuses, right? And those plexuses, they were draining into something, but finally the final destination being internal iliac vein only. But how are they reaching over there, right? So one, from the bladder, right? See, this is vesical plexus, right? Vesical plexus. So these vesical plexuses, they were very vital, right? Because they were forming all those vesical veins. And those vesical veins, they were draining into internal iliac vein. Fine. What about there was the prosthetic plexus, right? All these yellow color means they are plexus, vesical plexus, prosthetic plexus. Now these prosthetic plexus, see when we used to discuss the venous supply of prosthetic plexus, we used to say that okay, prosthetic plexus, all those veins, they drain either directly into internal iliac vein or via the vesical veins. Now see, it is how it goes. It goes like this or it goes like this. That means that prosthetic plexus, those veins formed surrounding the prostate, right? Few of them, they will be landing into the internal iliac vein and few will be going into the vesical vein, and then vesical vein is taking them to the internal iliac vein, right? Watch for this. Uterine plexus. So uterine plexus, so they will be draining into uterine veins. So this is easy, uterine veins, and they land into internal iliac. Same case with say vaginal plexus, and then there are vaginal veins, and they will be draining into internal iliac. What about rectum? There was rectal plexus, correct? And then those plexuses, they were draining into superior rectal vein, middle rectal, and inferior rectal. So that while discussing rectum, we said that this is very, very important association, because middle rectal and inferior rectal, they will be landing into finally internal iliac, but this superior rectal is actually inferior mesenteric vein to the splenic and all the way to portal vein, right? So now it is clear, right, that why these plexuses, they are so important. Okay, see, this is how they really form, right? All are venous plexus. So this is vesical venous plexus. So I would just say tell you to appreciate that how these veins are in, like this is how that clusters, how are they, the meshwork is arranged, right? This is venous plexus and vesical, so bladder. Now see, in venous plexus, in this vesical venous plexus, we said that prosthetic venous plexus. So here it is prosthetic venous plexus. This prosthetic venous plexus, it drains into vesical venous plexus, right? And then from here it goes into all the way into the inferior, that is internal iliac vein, right? But this was one important point. Okay, see the shape itself, right? This would say that yes, this can be only rectal venous plexus, rectal venous plexus. And in rectal venous plexus, it is we talked about this, right? Middle and inferior rectal veins. And these, they will be landing into internal iliac vein. While one more, right? That was the superior rectal. Superior rectal. And that superior rectal, inferior mesenteric vein to splenic to finally portal vein. Right? This much is good. And here it is. This one is the prosthetic venous plexus. Prosthetic venous plexus. Right? Just at this level, this is uterine venous plexus. And it would be draining into, and that's the uterine vein. And it will be draining into internal ilia, right? Yeah. And this one is the vaginal venous plexus. So that's how they are arranged. For lymph nodes, this one page can help you a lot. In case if any question is asked or if anything is asked, you can very confidently speak about lymph nodes of pelvis. Right? This is in fact like the whole circuit. 1, 2, 3. Start with that there are internal iliac nodes. So those internal iliac, right? See, there are external iliac and internal iliac, and then there are common iliac. So if we write it something like this, say common iliac nodes, right? External iliac nodes and internal iliac nodes. External iliac would drain into common iliac. Common iliac would drain into lateral aortic. Then from there are para-aortic, etc. Right? Lateral aortic nodes. So that becomes the path. So what would external iliac do? And yes, this internal iliac will also. So it is also going into this common iliac. So what this external iliac is draining and what internal iliac, that's the entire game. External iliac would be going into the inguinal region, right? So here there would be like membranous urethra, prostate, right? All of those. Bladder base, then uterine cervix and vagina. All of them, they would be draining into inguinal nodes. And those inguinal nodes, they will be into external iliac, and it goes. For the internal iliac, all the pelvic viscera, right, apart from these, and the deep perineum. That's it. So that's what this apply to internal iliac, right? Now we start with those nerves. As we said, there would be lumbosacral trunk or plexus, right? We can say lumbosacral trunk or plexus. This would be one. Second one would be the coccygeal plexus. This is very small, very easy. Coccygeal plexus. And then the third would be pelvic splanchnic nerves, right? And right from the beginning, we were telling S2, S3, S4, and then this pelvic splanchnic, etc., etc. Right? Let's decipher all of them. One is that when we are talking about pelvic region, we'll be dealing with lumbar and the sacral part. Correct? So it is like there would be L3, L4, and L5. That is what we shall be dealing with. And in case of sacrum, it would be S1, S2, S3, and S4. And last but not the least, don't forget this coccygeal. So because it is one, so just it is CO1, right? Or we just write coccygeal. We don't have to write one or two because it is only one. These will be the fibers, right? For the nervous supply, we divide again into two parts, right? One is somatic and second is ANS, autonomic nervous system. And in that there is sympathetic and parasympathetic. Sympathetic, parasympathetic, somatic, that means they will not be going separately. No, actually, we were talking that it is like a conduit, it is like a pipe. In that pipe, everyone runs, right? Everyone takes care of it, take my fibers also, right? Give it to that organ. Then I'll control that organ from here, right? Because my those fibers, sympathetic fibers going all the way over there, but it is going via the spinal common nerve, right? So that nerve will be a mix. In head and neck, when we'll be discussing those cranial nerves, it would be like that some are sensory nerves, some are motor nerves, some are mixed nerves. So why it is happening like that, right? That's where all those white ramus, gray ramus communicants, right? All those ventral root, dorsal root, everything will come into picture. Uh, let's do one thing. It might take just 7 minutes extra, but let's draw it, right? So that there is no confusion of that what is this white ramus communicants, what is this gray ramus communicants, because otherwise we say that okay, it is carrying preganglionic fibers and we keep on wondering that from where it has come, right? Otherwise it is so simple, right? Because white ramus communicants, they will be carrying those preganglionic fibers and they will land into the sympathetic chain, and in sympathetic chain there are ganglia and then there starts the postganglionic fibers. But let's do one thing, let's draw it, right? It would not take much time, but this one concept will make the rest of the plexus is so easy, absolutely easy. So that's the spinal cord, right? And in spinal cord, right? So this is our gray matter and this one outer one is white, right? I'm writing less over here so that we can make a full picture over here. Okay, and one, two, right? Very crudely we are defining, we'll make it scientifically correct, not artistically, right? Scientifically it would be correct. So here it is, this is anterior, right? Let's take it this way, this is anterior. So that means this would be the anterior root, right? Anterior root of we are planning to form a spinal nerve, right? So this is the posterior root, but we'll not say them anterior and posterior. We'll call them a bit more smart, ventral root, right? and the dorsal root. Dorsal root. It has to do with embryology, right? Because it becomes much easier. Okay, so just a minute. I'll write dorsal root over here. So that because we'll be picking up few fibers from there. So this dorsal root, and then there is one ganglia, right? This ganglia is like a relay station, right? So you can just say that it is like a relay station. Relay station. So there is a ganglia over here. What name should we go? It is dorsal root ganglia. So easy, right? So it is dorsal root ganglia. So that's fine. Fibers, they continue. And from this side, from the interior also, they go and meet. And there forms a happy spinal nerve. Right? But had the things been so simple, right, then there is no fun in it. Now starts that autonomic nervous system. They have got this lateral trunk, lateral horn, right? It is lateral. So this lateral horn fibers, because when we'll be studying the spinal cord, right, that is in the brain. So we'll see that all these lateral spinothalamic tract, all those tracks, right, lateral tracks, they will be pushing their fibers. They say, yes, take my fibers also to the spinal nerve. But then story is okay. Now these fibers, they say, no, wait, right? The last minute change. They say that we do have a special sympathetic chain, right? And that sympathetic chain is so beautiful. So we would like to go over there, right? So initially they said that we would like to go into the spinal nerve, but then they changed their mind. No, take us to sympathetic trunk. So that is our sympathetic trunk. Now in sympathetic trunk, all these are what? Ganglias. Right? Now listen carefully. In case if you don't understand, tell me immediately, I'll explain it again. But this sentence makes sense that the fibers which we are talking about right now, these yellow color, these are the preganglionic fibers which are landing into the sympathetic trunk. And from sympathetic trunk, postganglionic fibers, they will be coming out. No, let's change the color. They will be going out and they will be going for the target organs. They will be going for the effector or the target, right? Respectively, wherever they. And this spinal nerve tells that fine, you want to go, I'll make a special path for you, right? And this continues. And this special path, which is carrying the preganglionic fibers to sympathetic chain, that is what is called as the white rami communicants. Why they are white? Because there is myelin, right? You know that in nerve fibers, right, there is this myelin sheath, right, which increases the conduction and at the same time it gives protection to those electrical impulses, right? It also increases the speed to almost 75 meters per second, right? So that is myelin. So because of presence of myelin, this is white. It looks white. So this is white rami communicants. Is this much clear? Because now we are about to add something which is Slightly not complicated, but you need to understand it, right? Because we are about to add postganglionic fibers into the spinal cord, spinal nerve. So this much is clear, right? Okay, if not, just let me know. Now we are dealing with those fibers which have landed into the sympathetic chain, right? Or sympathetic trunk or sympathetic chain. Sympathetic chain. Few fibers. These are postganglionic fibers. Postganglionic fibers, they would say, okay, no, that spinal nerve is good, right? We would like to go with her only. So then those fibers, these are like postganglionic fibers. They change their mind and they again enter into the spinal nerve, and then they'll say, okay, yes, we'll follow the spinal nerve. So spinal nerve would say, okay, well, in that case, I need to make once more another arrangement, and this path is connected. So, right, a separate part is connected, and this thing is called as the gray rami communicants. So now we know that when it comes to this spinal nerve which is going, this spinal nerve is carrying some autonomic nervous system fibers, because these are the fibers which were supposed to go via sympathetic chain to the target organs. Now few fibers, they came into the spinal nerve and then say, okay, as you are going, take us also. So these are postganglionic fibers. And yes, we are talking about spinal nerve, and story is not ending over here. This spinal nerve then tells that everyone is taking so liberty, so let me also. It tells I'll divide into two parts, right? As I'll be going out through that foramen, so then I'll branch myself. So again, we said that this is posterior and this is anterior, right? So these are called as the ramus, right? Ramus means branch. So there is a dorsal ramus, and the ventral ramus. So when we'll say regarding the lumbosacral trunk, we'll say that it is formed by the ventral ramus of lumbar and sacral region. Yes, it would make a perfect sense, right? And this ventral ramus, once again, it would be dividing into ascending and descending branches, right? So in coccygeal, we'll see that from S4 only the descending comes and the CO comes, and then they form the coccygeal plexus, right? Don't worry, it'll come. But at least this part is rock solid now. No problems, right? So that when anyone talks about the dorsal root or the ventral root, that means we are dealing with this portion, something which is just coming out of the spinal cord, right? Dorsal root and the ventral root, or the posterior and the anterior one, right? Then dorsal root ganglia, that is easy, correct? There forms the spinal nerve. So now spinal nerve, you know it. But then from spinal nerve, those fibers which are from the lateral horn, they say that, see, we are coming all the way, but now no, we want to go to sympathetic chain. So spinal nerve would say, okay, fine, take this white rami path, white rami communicant. So they'll go all the way and will land into the sympathetic chain. Few fibers, they'll say, no, we'll go back to spinal nerve. So yes, they start their journey, and this time this particular path, this one, that is said gray rami communicants, because they don't have myelin. That's why, because no myelin. Myelin is a protective sheath, right? That's the myelin. So if it is present, we say it myelinated, not present, so it is non-myelinated, right? And that's how it goes. And finally, the spinal nerve, right? Such a patient's spinal nerve, it tells that I want to divide as I come out of the spinal foramen, and divides into ventral ramus and the dorsal ramus, and then further journey continues. All good till this point, right? So with this, we now talk about lumbosacral. Because from this point onwards, things would be so easy. Sorry. So in lumbosacral trunk, why this is important? Just for two simple reasons. It will be giving two branches, two important nerves. One is the sciatic nerve, right? And second would be the pudendal nerve. One nerve which is important for movement. This is for the movements. And this one which is important for reproduction. So that's why this lumbosacral trunk is so important, right? So we'll be discussing sciatic and the pudendal, both of them separately. But when we say that this lumbosacral trunk, how it is formed, so what if now we say that lumbosacral trunk, right, from the L4, right, it makes sense. From L4, right, the ventral branch or the ventral ramus of L4, and to be more specific, the descending branch. So it makes sense, right? We know what is ventral ramus, right? That is the ventral ramus. This one is ventral ramus. And then one branch which is going down. There would be others, but this one which is going down, that is the descending ramus, right? So that is descending ramus plus L5 whole ventral ramus. How nice, right? See, now this is making a complete sense, right? It is making a complete sense that L4 and L5, how they are forming this lumbosacral trunk. But then this is the lumbar part. Where is the sacral part, right? Where is the sacral? Because that's what we said, lumbosacral. So for sacral, it would be like S1, S2, S3, right? They all will be participating, right? What about S4? Well, S4 is special. So that's why we'll write it like this, right? Because S4, how it is special? Let's see that. So this is the sacral component, correct? You'll see, you'll get the meaning within a second that why I have written it like this. Here it is. This is lumbosacral trunk. Lumbosacral trunk. How this lumbosacral trunk was formed? Lumbosacral trunk was formed by L4, right? L4. Here it is. There is L4. But in L4, it was descending branch. So that's why see it is thin. It is patla, right? Thin branch. So it is descending branch, right? L5 whole. But then branch or whole of what? Well, it was the ventral ramus. Ventral ramus. That's why, that's how L1, L4 and L5. Correct? Then S1, S2, S3, S4, yes, they are over here. S1, S2, S3, S4, right? And again, ventral, ventral ramus, ventral ramus. Few points to note in this case. One, see, this is superior gluteal artery. Putting a start. This one point will take you miles ahead. Why? Because this is superior gluteal artery is between the lumbosacral trunk right? In fact, this lumbosacral trunk and this S1, right? It is between both. So it is in between lumbosacral trunk and S1, right? And the S1. Similarly, there is inferior gluteal artery that is over there. But see, these are sciatic and the pudendal, these two. Why we were telling about S4, the S4 is that for pudendal, it is S2, S3, S4. Now you got the meaning why since long we were telling, remember S2, S3, S4. Say this is S2, S3, S4. These are the separate fibers, right, which are going all the way for the formation of this pudendal nerve. And this nerve will be supplying all those reproductive organs. So that's why it is important for that purpose, right? Reproduct. Sciatic, it is for movements, right? So that's how sciatic goes. And yes, regarding this S5 coccyx or coccygeal plexus, just keep in mind, right? We'll be coming to that. As such, it is easy, right? See, this is CO1 or the lonely coccygeal and the S5, right? The descending branch S5, they make this coccygeal plexus. Now see in this, the lumbosacral trunk, it is carrying, say, if we say L4, L5, S1, S2, S3, S4, right? Only partially from L4, from L5 it goes, right? Then from say S1 and S2, they are the major contributory factors, right? They are the major contributory factors because this is also carrying sympathetic fibers. So those sympathetic fibers, they are supplied by them. So all ventral ramus, that's how they give. So in lumbosacral trunk, say which is just in front of, you can see that sacroiliac joint, right? It is in front of SI joint or the sacroiliac joint, and we saw that it is associated with those vessels, right? Associated with superior gluteal and inferior gluteal arteries. You saw that. Okay. So once the plexus is formed, right? That plexus, which is formed by those ventral ramus, right? Ventral ramus. So they go and they form this plexus. From this plexus, there was sciatic, there was pudendal, nerves, right? For sciatic, it was L4, L5, right, from the top, and S1 and S2. So it is for movements, that is what we talked about, right? Regarding the pudendal nerve, that is for reproduction purpose, and it was classically S2, S3, S4, right? So far, things are easy, right? When I say ventral ramus, so ventral ramus from all, right? Except in case of L4, it was just the descending branch, right? Otherwise, from L5 onwards, all are full. Okay, when they go, right, they go, these fibers, they go for forming the plexus, right? They go and they form the plexus. Just before they go for plexus, some of the fibers, they would come out. Now, that's why it is important that this is before plexus formation. It means that if anything goes wrong to this plexus, these twigs, these small branches which has come out, right, they will save. They will save that organ. So this is like a backup system. So when we'll be talking about this pelvic splanchnic nerves, remember pelvic splanchnic nerves, right? They will be emerging before that plexus is formed. So it means this is the plexus formation and it is the redundancy, right? Those fibers, they will be coming out, right? Before plexus formation to form what is called as the pelvic splanchnic nerves, right? This is a superb backup system because organs are important. So that's why you'll find that this is how they are supplied. And to whom it is giving before this plexus formation, right? It is giving to those important muscles. See, piriformis, very important, levator ani, coccygeus. So it means anything goes wrong to plexus, these all of them, they will be spared, right? So piriformis is like S1, S2, this is S3, this is S4, right? S3, S4, and coccygeus. Yeah. So that's the basic layout. Yes. Yes. Okay. Now see the ventral ramus, right? Again, it is a conceptual thing. Ventral ramus is coming out. So that ventral ramus, this divides into two, right? And they are called as divisions, right? They are called as divisions. So there would be ventral division and the dorsal division, right? So whosoever is anterior will be supplying. So ventral division will do what? Ventral division will try to decrease the distance, right? Simple as that. Because see, in upper limb and lower limb, say in upper limb, this is flexion. But in lower limb, everything is rotated. So all the flexors, they go on the back side, right? So over here, one who decreases the distance, right? So distance decreases. So that means flexors, right? And adductors, right? They are drawing near. Abductors, they take away, right? Adductors add, they come near. So adductors. Dorsal divisions, right? They increase the distance, right? So they take everyone dur, right? In Hindi, right? So the distance increases. So D dorsal takes them dur. Who will do that? Extensors, right? And abductors. So it becomes easy, right? But when the plexus is formed, right, this is how the fibers, they would be going. Okay, so this was just one concept, and now we'll utilize that concept. Say in branches, we said sciatic nerve, correct? Sciatic nerve. Now, sciatic nerve, it has got two components, right? One is the tibial component, and second is that common peroneal, right? Though this is just part of that lower limb, but that's okay, right? Tibial component and the common peroneal component. Now, what tibial component would do? Tibial component would be supplying those hamstring, calf muscles, sole muscles, right? And this common peroneal component, it will be supplying to those foot everters, dorsiflexion, right? Dorsiflexion. So this means that this is dorsal, right? Dorsal division. And this one has to be the ventral division, because ventral division would be decreasing. So when the hamstrings, they are contracted, yes, right? They are decreasing the distance. So this is hamstring, calf muscles, right? Sole muscles. It becomes much easier when you explain it like this, because in sole muscles, all those flexion and adductors, right? Flexion and adductors, they will be supplied by this tibial, and this is because that it has got the ventral division, right? And ventral division of what? L4, L5, S1, S2, S3, right? Sciatic, right? So L4, L5, S1, S2, S3. Regarding the common peroneal, well, in common peroneal, it is L4, L5, S1, S2. That's it, not 3. Right? So they will be what? Extensors. They will be what? Abductors. Correct? So in other words, increasing distance. So this is the easy explanation. The second important nerve, that is that we'll just mention posterior cutaneous nerve of thigh. Right? That is posterior cutaneous nerve of thigh. In that also, dorsal, ventral. Now we talk about, say, those dorsal division branches, right? So all these dorsal division branches, which will be like for extensors and abductors, that is those who increase the distance. So one, say superior gluteal, right? See, this is helping dorsal side. Inferior gluteal, inferior gluteal nerve, right? Superior gluteal nerve. Then again that posterior one, nerve to piriformis, nerve to piriformis, that is also posterior, right, or the dorsal, and all those perforating cutaneous nerves, right, cutaneous nerves. Now in this, the order is interesting, right? Write it like this: L4, L5, S1, then L5, S1, S2, then S1, S2, then postcutaneous S2, S3, right? So that way, if you draw it like this, it becomes a bit easier. In superior gluteal, when we talk about L4, you can write very smartly that it is only the descending branch of L4, right? Only the descending branch for the lumbosacral trunk. That's how it is formed of ventral ramus, correct? Ventral ramus. L5 is full, rest other all are full. Regarding the anterior branches, right, or the ventral division branch, all anterior, right? So this is nerve to quad femoris, quadratus femoris. Then this is obturator internus, right? Nerve to obturator internus. Now in this also, it is L4, L5, S1, and here it is L5, S1, S2, right? Pudendal now, right? We saw that. And pudendal now you know it so well. S2, S3, S4, right? And those few fibers which were coming out, right? Levator ani into coccygeus, right? They were for S4, right? And finally that backup plan, that is that pelvic splanchnic. Before the formation, these pelvic splanchnic nerves, again, those pelvic splanchnic, they have got S2, S3, S4, right? So these are the two important areas. This is coccygeal plexus. And just one small explanation will explain everything. We said that coccygeal plexus, how it is formed? It is formed by S4. In S4, how? Ventral rami. Is it full ventral rami? No. Is it full ventral ramus? No. The descending branch. Descending branch. Right? That makes complete sense. Plus S5. Okay. And plus the coccygeal, now that is CO or CO1, whatever we say, right? So that's what is coccygeal plexus. And what it would be doing, right? This coccygeal plexus, it gives what's called as the anococcygeal nerve, right? And that is giving supply to skin in the region of coccyx. See in this. This is pelvic splanchnic nerve. And we said that is S2, S3, S4, right? So here it is S2, that's S3, and that's S4, right? S2, S3, S4. Ventral rami, right? We know that now. Ventral rami, S2, S3, S4. We talked about this pelvic splanchnic slightly before that, right? When we were talking about the nerve supplies. It joins inferior hypogastric plexus. Now, inferior hypogastric plexus was that which was supplying so many pelvic organs, right? So it means before the formation of that plexus, right? These S2, S3, S4, few come out, they form this pelvic splanchnic, and then they join inferior hypogastric. So this now requires a bit of explanation. That for the autonomic nerves, autonomic nervous system, we divide it into two parts, right? Sympathetic and parasympathetic, right? For this area, it is the sympathetic chain, right? Sympathetic chain. So that bead like it is going all the way and coming like this. And both the sympathetic chains, they are joining at one point. That odd ganglia, right? This odd ganglion, which is unpaired, which is just one, and this one is odd number, and that's why we call this impar, because in impar in Latin it is one or odd, right? Odd. So that is ganglion impar. It means we have got left sympathetic chain and the right sympathetic chain, right? Right and left. That's what happens over here. So we have right chain and we have left chain, and that's ganglion impar. Impar. This is sympathetic, right? So pure sympathetic. This thing would go to sacral and coccygeal, ventral rami, right? It will go to this ventral rami. That's where it is going. Now for the parasympathetic, what is happening? Those ventral rami, right? From S2, S3, S4. This is the only part which you have to understand. Ventral rami, it goes, right? It is carrying parasympathetic fibers, but some of them would go to superior hypogastric. Superior hypogastric plexus, right? Some will go direct, and this is for distribution of organs, right? And in order to distribute it to organs, it takes this to inferior hypogastric plexus, right? So this is how it is formed, that those ventral S2, S3, S4, right? They take those fibers to, and they lead to formation of inferior hypogastric. From inferior hypogastric, we have got all the way, these are the branches to, it goes to rectum, right? It goes to bladder. So then those branches will be called vesical, prostatic, all those plexuses, right? Prostatic. So these are all plexuses. It means inferior hypogastric will send the branch to rectal plexus, vesical plexus, prostatic plexus, right? Uterovaginal plexus. It will send to all of them because they are not like single nerve is going. A plexus is already formed, right? And this inferior hypogastric, that will give and supply to that. Also, it will give to rectum, right? But that is from lower ganglia. Now, what about this inferior hypogastric? If this inferior hypogastric is so important, so then how exactly it is formed? So for that inferior hypogastric plexus, we just saw that from top, right? Those fibers, they were from S2, S3, S4, they were going to superior hypogastric, right? Now, for the formation of inferior hypogastric, that superior hypogastric comes into picture, right? So this is like superior hypogastric plexus, right? It feeds inferior hypogastric. And that is by, once again, right and left hypogastric nerve. So this hypogastric nerve is the bridge between superior hypogastric plexus and the inferior hypogastric plexus, right? Then we already talked about that sacral sympathetic, that is the main contributor, right? Sympathetic chain. So this is the main contributor. Yeah, same, that ganglia impar, right? That ganglion, right? Ganglion, it cannot be ganglia. So, so that is impar, right? And the lumbosacral plexus. Now you remember this lumbosacral. Let me make some space over here. See, lumbosacral plexus, right? That lumbosacral plexus, which was having that ventral division, correct? That ventral division, before forming plexus, they were coming up with that pelvic splanchnic nerves, S2, S3, S4, and those pelvic splanchnic nerves, they are feeding inferior hypogastric. So this is a big contribution. This is the huge contribution, sacral sympathetic chain. But otherwise, others also supply, right? And then inferior hypogastric will give branches, as we saw above, to the respective organs. So that's how the nerve supply becomes so rich. Right? Now, when we say this, so then how this superior hypogastric plexus is formed, right? So for this superior hypogastric plexus, it is pure sympathetic, pure sympathetic, right? So this means there are no sacral component. It means there is no parasympathetic fiber into this. So it comes from lumbar region, right? So we have got L1, L2, and they are what is called as the intermesenteric plexus. Intermesenteric plexus. They feed, right? Plus L3, L4, and that is pelvic splanchnic, they feed superior hypogastric. So now you see that, see this pelvic splanchnic, that means from where? Yes, they are from that lumbosacral trunk. It means this is like a complete network. So in case even if one circuit fails, there is some other pathway from where things are actually reaching out, right? So that's it for today. Tomorrow it would be the final session for abdomen. And after discussing some of the basic few muscles, we'll discuss from the at the obstetric level, right? The entire delivery, that how the baby passes through the tunnel, right? And what's the importance of all those parameters, and how uh, say all those movements, flexion, everything occurs. That's what we'll discuss tomorrow. Thank you so much, and we meet tomorrow. Right? I've already generated the link, so see you tomorrow. Thank you and bye bye. Yeah, file saved, putting into our shared folder. Good night.